Hello, in this video we are going to learn about the typical features of the typical synovial joint. It has got certain features. Here we can see in the synovial joint where we can see the two bones, they are participating. So it is a simple synovial joint, and it comes into the category of the diarthrosis. Diarthrosis literally means the joints which have got joint cavity. So here we can see the two bones, they are participating, and their articular surface are covered by this blue thick layer, which is called the hyaline cartilage on both of the bones which are participating. And beside that, these bones, they have this joint, they have it has got a capsule around the joint. So this capsule is further comprised of two layers. The pink one, which you can see outside, it is the fibrous layer, whereas the blue one, which is inside within that blue layer, is synovial layer. This pink one, you can see it goes and attached beyond the articular margin of the bone. What is articular margin? Articular margin is a point where actually this hyaline cartilage, it doesn't continue further. So here this is articular margin, because this blue one, hyaline cartilage, it is finished here, and beyond this point it is not continuing further. So this whereas this blue layer, which is called fibrous layer, it goes and attached onto the bone on either side which are participating in a joint, and it gets attached beyond the articular margin. Whereas in next diagram we can see very well this pink layer in between, it is actually the fibrous layer, whereas the green layer, this is the synovial layer or synovial layer of a capsule. So here you can see this synovial layer of capsule, it goes beyond the articular margin, that it's fold upon itself and then moves again towards the articular margin and gets attached over there. And this layer, synovial layer, it doesn't continue further beyond the articular margin, or it means that it does not cover the articular surface. Otherwise it would have been crushed between the two articulating bones if this synovial layer would have been continuing beyond the articular margin towards the this synovial articular cartilage. Whereas you can see on either side, this is joint cavity between the bones and capsule. This joint cavity is filled with synovial fluid. Synovia comes from the word ovia, means egg white. So the nature of the fluid, or the appearance of the fluid, is like egg white, so that's why it is called synovia. And what is actually ligament? Here you can see this outermost pink layer is ligament. Ligament is nothing, it is just thickening of a external fibrous layer on medial, sometimes on medial and sometimes on the lateral aspect of a joint, sometimes anteriorly, sometimes posteriorly. So we call it ligament. So ligament is nothing extra, rather it is a thickening of a capsule on anterior, posterior, medial or lateral aspect. So in a way, capsule it gets thick on some aspect and remains thin, while remains thin on others. So that's why so we call that capsule a ligament. So again, you can see the typical features are capsule, which has got outer fibrous, and the green one inner synovial layer. then articular cartilages covering the articular surfaces, then we have got synovial fluid within this synovial cavity, joint cavity. So this outer fibrous layer, it gets attached beyond the articular margin, whereas the green one, it gets attached to the articular margin. It doesn't continue further onto the articular surface. Articular surface. So that's why this is these are the typical features of a, and this formation of ligament is nothing, just it is a thickening of capsule, joint capsule, on the medial, lateral, anterior, posterior aspect. So the joint capsule, if we see on cross section, the joint capsule is thick somewhere and thin somewhere. So where it is thick, it is called ligament, and where it is thin, it is called capsule. And sometimes this thin part of the joint cavity, it is weak, so that synovial membrane outpouches from that weak part and becomes a bursa, and such bursa, they are continuous with the joint cavity. Means the synovial fluid of the bursa and joint cavity, they are intercommunicating with each other. Thank you very much.